Five, four, three, two, one. Now we're talking with Muscular Dystrophy Ireland in the form of Ashling Kennedy, who is the Chief Operations Officer. And you're very, very welcome to Disability Matters.
Thank you for having me, John.
It's our pleasure. You might start by telling us a bit about muscular dystrophy, what it is, and what are the symptoms.
Absolutely. So MDI, we support people that have muscular dystrophy and related neuromuscular conditions. What muscular dystrophy is we support over 60 conditions, but there's sub-conditions within them conditions, so it's really up to 90. There are many types of muscular dystrophies and kind of related neuromuscular conditions. Most important thing about muscular dystrophy, it's the hardest thing about it is that it's rare. Okay. So it's a rare condition. So it's hard to connect people in. It's also genetic. So, you know, if you do get diagnosed with muscular dystrophy, depending on birth, childhood, or later in life, any one of us could get muscular dystrophy. It's just, you have to get your whole family tested.
Yeah.
And you'll find that we're supporting families that may have 2 children or 3 children or adults, you know, sons and daughters, parents that have the condition. Some conditions are more progressive than others. I mean, the ones that are the most progressive would be SMA and Duchenne. But I mean, once again, it can present at birth, childhood, or later in life, and depends on which condition you have. It does affect the muscles in the limbs, but also muscles such as the heart and lungs. And that's more kind of SMA, which is spinal muscular dystrophy, that would happen. And I suppose a few other quick facts for like Duchenne, and I spoke about this to you before. Duchenne would probably be one of the most common, and it would mainly be mainly in boys, young boys, and it would diagnosed quite young. The rate of progression for SMA, as I mentioned, and Duchenne would be quite high. We're doing a few campaigns at the moment around treatments that our European counterparts have that we don't have for Duchenne and SMA. So we've been working on them campaigns all last year and into this year. But kind of that hopefully gives a good bit of idea. Like we will have many different types of conditions. So I mean, we could have someone maybe just only needs a walking aid or a manual wheelchair, or unfortunately needs a power wheelchair and a high level of support. I hope that gives a little bit of a background.
It does, absolutely. It's a very, very complex condition, or is it a disease?
Some people call it a disease. Some people call it a condition. It's that's a hard one because people don't want to be associated with a disease. But there is no cure for muscular dystrophy. There's treatments. We have some treatments for some conditions, but once again, Duchenne and SMA, we're working on high-level campaigns with the HSE and Biogen and all them bodies to get certain treatments into the country for them. So, like, there's treatments that can delay the progression, you know, but there is no cure.
I get you. Like a lot of complex conditions and diseases and so on. Before I jump into my questions, is the reason why Europe has a treatment and Ireland hasn't down to money?
Yes, it's down to money. And we have a research officer, and she'd be very well educated in this area, and she uses that language, but I wouldn't be as good. But she's working heavily on that. But it all comes down to politics, you know, navigating the system and money. It does come down to money because the cost of some of these treatments are extremely expensive, especially for the one that we're trying to advocate for Duchenne and SMA at the moment. And you'll see, if you go onto our website, you'll see the type of stuff we're advocating, the type of people we're advocating to, which is the health minister. And we work together collaboratively with the bodies. But it does come down to money and reimbursement of the drugs. Yeah.
It's sad, isn't it? But do you know how many people have it?
So the statistics aren't great in Ireland around muscular dystrophy. We estimate, based on research, roughly around, like our CEO would say, roughly around 1,000 no, sorry, 3,200. But I do believe it's higher than that.
Okay.
But that's just based on research and clinicians doing research. But in general, there's no system within HSE to actually tell us just
Okay.
3,200.
I get
But
you.
it's roughly around that estimate. Yeah.
And I always ask this question lately. If I am the guy who is diagnosed with muscular dystrophy, am I referred to Muscular Dystrophy Ireland automatically?
So basically, our systems have got stronger even since I last met you. And we the clinic liaison officer within the clinic. So the main clinics, unfortunately for people, the main clinics are in Dublin. So if you come from the west and the south, you have to come to Dublin to see your
Yeah.
clinicians or your multidisciplinary team. So there's a lot of travel involved in that. But we have a clinic liaison officer based in Beaumont and all of the children's clinics. And because she's there and she's built the relationships over the last 2.5 years, they're referred to us immediately. Everyone knows about us now. So they can go to our information advocacy support line, and the leaflets will be in the clinics if she can't attend the clinics, but she's there as a presence. So we are the referral system, and it's been a great point of contact to get people in straight away. Some people aren't ready, as you can imagine.
Yeah.
You're getting a diagnosis, whether it's for your child or whether it's for yourself. You were independent for a very long time and all of a sudden you're getting this diagnosis. So some people are ready and will have a lot of questions and want to ring our information advocacy line, and some people just aren't. But we are the main referral system, and all the consultants would know about us at a high level
Very
now,
good.
even if we're not present yet.
You're one of the very, very few, and we talk to loads, who have automatic referral. So you're very lucky like that.
Yeah, it's just natural, John. Like, it's not like, yeah, look, we've built relationships, I think.
Yeah, that's
So
right.
yeah, so it's natural that we are getting them referrals now, and everyone, our awareness and our PR is just much better.
Brilliant, brilliant. So if we get on then to Muscular Dystrophy Ireland, can you tell us a bit about the history of that and when it was founded?
Yep. So we're over 55 years now
Oh, wow.
founded, and we were founded in Galway by a group of parents. They came together at a kitchen table like most charities do,
Yeah, yeah.
because they see the kind of gaps in the system and how fragmented it was for their children. Um, so yeah, we're founded then. I mean, since then, I mean, our services we would have, so don't forget anything. Services like we family support service, that would cover a lot of type of different things. Like we educate professionals, most importantly,
Yeah, yeah.
because it's a rare condition. People don't understand the disability, and time again, you'll find like an OT, a physio, just doesn't understand it. And how progressive it can be, and the different conditions, because we're across 60, if not 90, sub conditions. So that's a really important role for a family support service. Transitions is a really important role for us, like, trying to help parents through different transitions across primary, secondary, into third level, into employment. It's
Yeah.
just really, really important. And educating and then professionals is so important, like employment, school teachers as well, SNAs. We do a lot of work with that kind of type of area. Connecting with others is a very important program under our family support service,
Yeah.
because it's quite, our members will say time and time again, they feel so excluded from society, depending on where they live in the country, especially rural areas. Assistive technology would be another program under our family support
Oh,
service that would be very, very, very important. And it's an area we're getting stronger and stronger in. We work very closely with AHEAD, and educating our members on, what type of technology they can get. It's such a fast environment. We have to
yeah.
stay on top of that. And we have a youth service. Our youth service, actually, we're working with Barstown Camp. We have our camp later on today
Very
over
good.
the course of the weekend. So that's a brilliant camp. If anyone wants to go on our website, you'll see a slideshow in the next coming 2 weeks. But it's a brilliant, brilliant initiative, and it's a family camp. It's holistic. It has the siblings, it has the parents, it has a child with muscular dystrophy. So it's a camp that year on year has been unbelievable for us. And they work across a good few other things, like, you catch ups, online siblings program, very important, is a new initiative that we've been running of late. And then just school awareness talks and webinars. We run it with, I forget the name of the company, but It's CDP credited for teachers and SNA, so it's great. Clinic liaison officer, I mentioned, extremely important referral service for us, and it also takes off the pressure points within the clinics, like for the consultants, because it's a hard diagnosis to get, and then also the change in the diagnosis that you may get. It just takes that pressure off, because she's more the emotional support as well as the driver of, these are the services that you can access. Counselling service we have. It's short-term emergency, but we only do up to about 12 sessions. But we will advocate to the HSE if a member needs more. Person assistance service we have as well. We do that definitely emergency short-term, because it's really the job of the HSE, and we don't get funded to do that long-term.
I get you.
So we do a lot of advocacy work with healthcare packages, and sometimes the HSE aren't ready to step in, only because, like a primary carer, if I'm a primary carer and I get hurt and have to go into hospital, it's just for us to step in on them emergencies only. Until we get the healthcare package in place that maybe a member needs. That's just an example. National advocacy is massive for us.
That's big time, yeah.
Yeah, because we're not we're funded by the HSE, but at the end of the day, our job really as a charity is not to exist if we could not exist. So, that the state bodies take it over, but we really, really do have to do a lot of advocacy work. And as I mentioned, we're SMA campaign, we're working on the Shane campaign around treatments, but we're also working heavily with Beaumont Hospital, they've been great. And the main adult hospital, working with the senior management and the CEO. And as of late, we're able to get, because the facilities aren't, because such an old hospital, they're not up to the scratch of where our, time and time again, I'll find, John, I said it to you before, they say things are wheelchair accessible, but they're not power wheelchair accessible. And the toilets weren't fit for purpose, so we advocated for a changing place toilet that had a hoist in it that was, completely accessible, and we just got launched last month, which is brilliant. It's brilliant for us, brilliant for Beaumont, and it's small little things matter, We've researched service, as I mentioned. She's working on a lot of trying to advocate for them treatments that we should have in this country that we don't, for certain conditions in muscular dystrophy. I mentioned before, and it's an important one, because we have a home from home, so it's fully accessible, may I say, a respite unit up over our offices based in Lucan, very close to kind of the city centre, everything that you need. And it's not just available to our members, we do it at discounted rate. It's available to all disability charities.
Oh, really?
And and you can go online and book it. I can obviously send the links as well. And the good thing about it is it's discounted, it's extremely accessible, and it has everything you need in it, from AT, we've got hoists, we've got everything. And I think we're trying to over promote it a little bit more, because it's such a great, unique selling point for us to be able to give that over to other charities. And we have other stakeholders coming in as well, as we use it for our members. Then we have, what's a good thing is our transport and equipment disability loan service. And we will provide this to, not just people with muscular dystrophy, to people that are, other disability charities. But the great thing about the transport service is it's Leinster based, so it's limited now. We only have one driver, one full-time driver, and then a few volunteers. But when people come up from the country, because unfortunately they have to come from the hospitals, they have to come up to the hospitals here, as you know, from the south and the west. It's a lovely reassurance to know that you're coming up to a home from home that's fully accessible, and then you have a transport driver, if available, to bring to the hospital appointments and bring you back.
Wow.
So that's really, really good. And then obviously we have a fundraising service, as every charity does. So that's, hopefully I've given you enough there.
That's extremely busy. You must have some amount of people working there.
We're actually a small charity, on record 22 staff.
Right. Do you have volunteers?
We do. We've about 15 volunteers. A very small base. We're trying to grow it.
That's a very busy charity. Now, which of them is the busiest service?
Support services, which is family support, youth support service, and clinic liaison service, counselling, and personal assistance service. If people just want support, if they want information and practical support when they get a diagnosis or a change in this diagnosis.
I think,
and a listening ear, I think, John, is
yeah,
the most
that's a
important,
big
because
thing, yeah.
we're in shock. They're in shock, yeah.
Yeah. I believe that the peer-to-peer piece of what you do is extremely important, because when you get the diagnosis, you think you're the only one who has it.
Yes,
And then
exactly.
you find out other people have gone on that journey.
Absolutely. And I've been collating member stories of late, just the last few weeks, because we're finalising our annual report. And the member stories coming in are over and over and over again. And you'll see it in our annual report if anyone wants to go online. It'll be published in the next few, probably 2 months.
Yeah.
But it's over and over again. I felt alone. I felt alone in my diagnosis. I came out of that consultant's office. That consultant is very busy. They don't have time to do the emotional support of that, or the peer support of that. But they feel they're, because it's a rare condition, they feel they're completely alone. A clinic liaison officer fulfills that need, and you'll see some member stories around that. And then knowing that we have a relaunched last year information advocacy support line. So it's a one-stop shop where you can ring straight away if you're ready, and you will get a support worker at the end of the line. But yeah, people feel alone. Yeah.
That's extremely important. Do you do anything for families? Do you include families in all the services that you provide?
100%, because it's holistic, isn't it?
Yeah.
So the camp that we're running later today with Barrettstown over next week, this weekend, is like full on with families. And families will say time and time again about this camp, because it's their third year in a row partnership with Barrettstown. They will say it's unbelievable. Actually, one testimonial I got in just of late was from a family that said, listen, my child was too young to get it, because like 2 or 3, whatever. But the amount of peer support I got from it, from just meeting another family that's in this situation, has been powerful. And then we run a lot of family connection events. So, might be things like, what do we run of late? Like the zoo lights. And we bring people to our office and they connect in, and we bring them over to the zoo lights. So we do a good bit of family events. And what we try to do with the youth service is, what we found of late works much better than just dropping your kid and going, is that we did so we run an independent living program, and of late we ran assistive technology workshop, but we asked the parents to stay on site for it. And we brought all the equipment in, head brought all the equipment in, and it was amazing. Like, we got such a high attendance, and it was great for the parents as well as the children to see what type of equipment they could use in the future. So yeah, 100%, all family, holistic.
That's happy days. What about members of public? Can they get involved in your service?
Yes, and we're slight bit poor at that at the moment. So we have a fundraising department that kind of is kicked off now the last year, and we're trying to grow it and grow it and grow it. So like we have a volunteer button on our website. So anyone that wants to volunteer, regardless of what capacity, because we have volunteers, like we have a volunteer at the moment that has a lived condition, family, like a family member has passed away with muscular dystrophy, and he's doing life coaching for us for free.
Very good.
Like, he's an experienced life coach. So you can volunteer in any capacity. You can go onto our online, onto our information button and just go, I'd love to volunteer, or go onto the volunteer button. Or you can, just, if you go into that, and if you want to fundraise, if you want to help us with our services, if anything you want to do, you just, do a web query, and we'll be on to you straight away. Yeah.
Now, I'll ask you this again at the end. Just give out the website, so if there's anybody listening and they want to get involved.
www.mdi.ie.
Brilliant. Now, you mentioned fundraising. Have you anything going on now or in the very near future?
Yes. So we have 3 big fundraisers we're doing at the moment. So we do what's called Love MDI, and that's not till February next year. We do it around Valentine's. So we need to grow that. So that's kind of a campaign where we're going to shopping centres. We need volunteers, and just fundraising. We give out these Love MDI candles and little chocolates. So it's a small campaign, but we'd like to grow it. That's in February every year. We have this amazing campaign coming up. It's been 3 years now running with it's called the Ollie Hickey Fund.
Okay.
And Paddy is his dad. He's a young chap. He was on the Late Late toy show. It wasn't last year, it was the year before. He's a drummer.
Yeah.
Yeah, he's a drummer. So his dad walks from, he picks different places, but he does it over 5 days, and he walks from a certain place, like, and he ends up in Enfield all the time because that's where they're from.
Okay.
But it's a very, very long walk, and he raises over 50,000 a year for us. So it's an unbelievable, and he's from eBay, so eBay are very heavily involved. So that's running in again in, I can't remember, but you'll see it. You'll see a few things on our website probably around June. I think we're running it again this year. But amazing fundraiser. I think they're the main two, but we do have a lot of small fundraisers.
Yeah.
So anything you want to get involved in, just follow us on Twitter,
Yeah.
Facebook. We're very good at social media, so I'd like if people could just follow us, and you'll see,
I was on your website, and it's full of information. It's full of information for people who have muscular dystrophy, also for families, and also for the general public. And it's very, very easily laid out and very impressive.
Thanks, John. And then our news updates we send out weekly. So all you have to do is go on our website, subscribe to our news update, and you'll see weekly updates on treatments, advocacy work we're doing, lovely smaller events, the youth service or the family support service or Peer Connection. And it's definitely, that newsletter is for the public. It's not just for our members, because our members, we send out direct emails via a CRM and things that they may need to sign up to. So yes, please sign up.
Fantastic. Now, we've come to the end of the interview. Is there anything else you'd like to say before we leave it?
I suppose just a few things around challenges our members face, but I think most disability charities face. Obviously funding is always going to be an issue, but we work very heavily with Dublin and the HSE, our state bodies, and fundraising. But for our members, I suppose it's just a day-to-day living, like independent living, access to PAs, healthcare packages. Like, it's not the HSE's fault, but because our disability is so progressive, they're not getting access to the level they need, at the time they need. And then sometimes because they get the diagnosis where they're just all of a sudden, because it's so progressive that it can just be this week to next week can just be so different for some of our members. And they need a higher healthcare package in a timely manner, as quick as possible. Access to treatments, I've mentioned already. Like, it's not fair that our European counterparts have these treatments and we have, SMA not getting the treatment they should have, rightly so, and Duchenne. I suppose accessibility issues is always a huge thing, isn't it?
Always.
Like, for us, like John, like I mentioned it earlier, but like they think like things are like it's wheelchair accessible. It's not wheelchair accessible. It's not power wheelchair accessible. You couldn't turn a power wheelchair around some of them toilets.
Absolutely.
And hoists. And I think that's, I think for me, like, I think when we're building new buildings and all that stuff, it has to have a person with a lived experience that understands the disability as they're developing things. And I think times are changing, but we've just got so many old buildings in Ireland. I suppose the lack of understanding is a key thing for our members, of the disability, and that's an area we want to be really getting strong in, where the next strategic plan is now for the next 3 years. And it's an area we want to really, really, really educate professionals, because you'll find at times it's no one's fault, but because it's a rare condition, all of a sudden you get a child with Duchenne in your school, the teacher doesn't understand, the school aren't prepared. It could be simple things like that ramp is not suitable for the weight of that wheelchair, and it's preparing, all of these professionals, the teachers, the SNAs, the, consultants know what they're doing clearly because they're in that space. But like sometimes psychologists, counsellors, we have to do an awful lot of education in that area. And I suppose that's kind of the main things. And I hope we progress forward and educating people the best we can,
Brilliant. last thing, just throw out that website again. So if there's anyone listening, they'll be able to take it down.
Yeah, www.mdi.ie.
Very good. Ashling, thanks so much for chatting with us at Disability Matters once again.
Thank you for having me, John.
Thanks a lot.
Take care.